We are going to scan a 14 years old girl with the only complaint of pain in the abdomen constant for a few months, and with no clinical examination notes, with no history of the patient, no lab investigation. So we start from the liver and you see that the echogenicity of the liver has gone down much. That's the reason why you are able to see the multiple tiny 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. These are all minor portal vein radicals, and these are seen in diffuse decreased parenchymal echogenicity when the echogenicity of the liver has gone down. Now this is the pancreas, this is the gallbladder, this is the portal vein, this is the inferior vena cava. The liver is okay, its outer surface is smooth, but as I come with the hepatorenal angle, I do see a fluid layer in the hepatorenal angle. This is the right kidney, partially visualized, not completely, and this is the liver with diffuse decreased echogenicity or brightness, and these are the bowels. These are all bowels. Now this thin line, this black line you are seeing between the liver and the kidney, the right kidney, in longitudinal section, kidney is in longitudinal section, partially viewed, not completely. So this line is the fluid, what we call as fluid in the hepatorenal angle. So there is fluid in the hepatorenal angle. So we have this finding with us. First finding, this is the fluid there within the hepatorenal angle. Okay. Now, by itself, the kidney is seen normal, gallbladder normal, portal vein is normal. There is no dilation of the intrahepatic bile ducts. There is no focal lesion in the liver. There is no pleural effusion. No fluid seen above the diaphragm. Though, to my experience, I will say that there is some fluid more than normal above the diaphragm, but generally we don't report this. This is the diaphragm, right hemidiaphragm, no fluid in this area, coming to the left lobe of the liver. Now this is the left lobe of the liver with its branches of the portal vein. The outer surface of the liver is smooth, the angle of the liver is sharp. Okay. बेटा एक लंबा सा लेके सर ऊपर. So the hepatic veins are not dilated, right? Better. And the subcostal appearance of the heart, rather now intercostal, says that the heart is not alive. So the cardiac, renal pathologies are ruled out as a cause of fluid that was seen in the hepatorenal angle. This is the spleen. This area is the spleen, measuring 9.2 centimeters is within normal. No fluid in the left pleural space. This is the left hemidiaphragm. This is the left kidney. Left kidney is normal. Right kidney is also normal. Now coming down from transfer section, from the lower area, lumbar region of the subposterior region, with patient supine, moving the probe downwards, magnifying a little bit, and magnifying the image, and then coming down straight. Here it gives you an impression of fluid. Now on the left side, this is the source major muscle. This is the paracolic gutter. Above it, there is very small amount of fluid in the left paracolic gutter. This black area, this black area. Now in the pelvic region, you can see that this is the longitudinal section that shows partially filled urinary bladder. This is the urinary bladder, partially filled. This is the uterus as seen through the ascitic fluid. This is the fluid. Now through fluid you can see that the uterus myometrium is normal, endometrial canal is in secretory phase. This is the cervix. So these areas are normal, no focal lesions seen. However, fluid is seen in the pelvic cavity, and this area, all this area is fluid. This is all fluid. This is the urinary bladder. Differentiate between the fluid in the pelvic cavity and the partially filled urinary bladder. Now this is the urinary bladder and this is the fluid. Okay, now in transverse section, this is the transverse section of the uterus, and in transverse section the uterus is seen surrounded by ascitic fluid, and this is the right, left area, left adnexa, and with this being the ovary, left ovary is normal. There is some follicular activity seen. The age of the patient is 14 and is in late secretory phase, as the endometrial canal suggests. This is the transverse section. Okay. This is the uterus in transverse section. This is the ovary, the ovary. Now, coming towards the right adnexa, we see a thin-walled, multi-septated, full of septa, complicated cystic area that measures approximately 4.7 into 4.6 centimeters. These thread-like structures that you are seeing within the cystic area are the septas. These are all thin septas. Now, why it is cystic? Because you see the posterior wall acoustic enhancement and acoustic enhancement posterior wall. Now, does this cystic area change its shape when I give a 90-degree? I rotate the probe more than 90 degrees, and you can see that the cyst retains its size, shape, and posterior acoustic shadowing. This is the posterior acoustic shell. The bright area you are seeing is the posterior acoustic shadowing from the cystic area, complicated cystic area with septals, the thread-like structures, thin spread-like structure, thread-like structures are the septals. Now if you concentrate in this area, this is not as black as this area is. Clear fluid will appear as you are seeing in this region. This is clear, but this is full of debris. So this finding is, as right ovary is not visualized separately. So this is a tubo-ovarian mass of infective nature in the region of the right adnexa that is surrounded, that also is surrounded by the fluid, the ascitic fluid. So in conclusion, what I will conclude is that this is a case of tuberculous bowel disease with this tubo-ovarian mass being also representing the tubo-ovarian mass, cystic complicated mass of infective nature. Rest. This is the fluid. This is the fluid. This is the fluid. If I decrease the gain, now you will see that the fluid is clear of any echoes. Other findings persist, and the endometrial canal is measures 10.8 is in secretory phase, surrounded by fluid. This is the urinary bladder, almost empty, and this is the ascitic fluid. So this is a case of ascitic fluid. This is more fluid. These are bowel segments. These are the bowel segments. This is the fluid in the dependent region, peritoneal cavity. This is the urinary bladder.